friends, welcome back to our hair loss treatment show, episode 10. Today we are talking about, is shaving the hair compulsory in hair transplant? As some of you might be aware that for performing a hair transplant surgery, usually we shave patient's hair, we trim them to zero level, then extract hair one by one from back of your head and implant them in front one by one. So that's how we do it in FUE. In strip surgery or FUE, we usually do not shave the head. We keep them as it is. We keep the hair of the same length. We just trim a small narrow zone at the back, take out a strip and dissect it and put it back. But in FUE, when we are taking out from the donor zone, we need the outer hair to be as small as possible. The reason being that on the skin, the inner hair angle is little different as compared to the outer hair angle. So if we have a long outer hair, it's very difficult to take out the inner hair in a proper way. You end up cutting the hair. In order for that not to happen, we trim the hair as small as possible so that we can directly target the inner angle of the hair and take out the graft in toto. So now, this trimming of the hair, cutting short of the hair, sometimes makes it difficult for the patient to plan a surgery, particularly if they are in the field where they are dealing with in public dealing fields. So it's difficult for them to go shave and then perform the procedure and then wait for the hairs to grow. So is it possible to do it without shaving? In few cases, yes, but in most cases, no. So which are those few cases in which we don't trim the hair completely? One is a small session. So usual hair transplant sessions are, average cases around 3,000, 3,500, 4,000 graft sessions or even more than that. But sometimes when the baldness area is small or we are performing small sessions like 500, 600 grafts or 1,000 grafts or so. So in that, we don't have to shave the entire back area. We just trim a narrow strip at the back and try to take out those small number of hair from that. The remaining hair above cover that trimmed area so that it's not visible that some area has been trimmed from behind. So that is what sometimes we do, that we just trim narrow strips and try to take out hair and rest of the hair cover it. That is one way of doing it. Second way is known as non-shaven FUE. So one is a minimally trim. Second is a non-shave FUE. Now in non-shave FUE, we don't trim at all. There is not even those small strips which are trimmed out. Say for example, we are performing a 3,000 grafts session. We individually count those 3,000 grafts and go on cutting those 3,000 hairs separately and try to take out the graft from that. So, as it sounds, it's a very laborious and lengthy procedure because you are individually counting 1, cut it, take out the graft, 2, cut it, take out the graft. And in that way, you are reaching up to 3,000 grafts extraction and then you are putting back in place. That cutting of the individual 3,000 grafts also follows a particular pattern so that you end up finding what you have cut. But yes, it is possible. So, if desired, can be performed in that way. As I say, it's very lengthy and very tedious procedure. Sometimes surgeon doesn't really prefer that procedure because you end up focusing on the long hair instead of focusing more on the grafts that you have taken out. Having a clear field of vision while you are operating makes the procedure much more easier for the surgeon and the precision improves as compared to working amongst lots of long hair. But yes, so non-shave FUE is possible. And the third technique is long hair preview. So, as we discussed, that in non-shave FUE, we are not shaving anything, we are cutting individually those 3,000 grafts. In long hair preview, we are not even cutting those 3,000 grafts. We are cutting the hair of the same, we are keeping the hair of the same length as they are. There are some specialized punches and specialized machines available which can work on a long hair. So with those specialized punches, we are encircling the hair and taking out the graft in toto, with the outer hair being long. So in these cases, the grafts that we have, they have long hair outside. and we are putting them directly in place in the front area. So the moment we finish the surgery, the patient has those long hair in the implanted site, so they have their new look at the moment we finish the surgery. But it's called as long hair preview because, as some of you might be aware, that in hair transplant, once we finish the implantation, after a few days, the newly implanted hair they shed. They start shedding, they start falling, and then they start growing back again after 4 months. So whatever we have implanted, whether it has a long outer hair or it has a short outer hair, ultimately it is going to fall. So whatever new look patient has, it is there for only few days till the new hair starts falling. So that's why long hair FUE is not really that you have the long hair and they'll be there. They will eventually fall, but it will give you a preview that how it will look once they again start growing back again. As the method sounds, it is tedious, it is time consuming, laborious, and sometimes need more hours or more days to perform a long session or to perform a large session. But yes, it is possible. So with new devices and new punches and instruments available, non-shave FUE and long hair preview is possible given a choice. Sometimes patient decide whether a particular patient should be undergoing this long hair procedure or whether a trimmed and completely trimmed hair procedure is more precise and more comfortable. So this is what some of the newer advancements which are available as regards to trimming. If you have any questions, please feel free to write to us. Thank you.